All right, listen. We'll be talking to a few people about this all important topic. Dr. Foster Ansong Bridjan is Acting Director of Operations for the National Ambulance Service. He's got lots of information to educate us with. Kwame Asiedu will also be joining us, no stranger to our show. Of course, he's with CDD and he's also a pharmacist. He's in the UK and he'll be joining us via Zoom. All right, now, first of all, let's situate this conversation. It's a question you've heard Winston ask on the show before. I mean, if you were ever beset by an emergency and you couldn't speak, you couldn't move, you were incapacitated, would Ghana's emergency system save your life? So we went out and asked people to tell us their experiences of Ghana's emergency services. Listen to this.
My own son was not feeling well, so I took him to a hospital near where I stay. So in fact, they said they have to transfer the 37. So the hospital, they tried to call ambulance service. Myself, I'm a staff from NADU, so I know I have their contact, so I also called. And in fact, where are you? This is the problem. Where can we locate you? About almost an hour. So finally, I have to forget about them and then pick a taxi. So I pick a taxi to 37. So later, I even reported to the case to the ambulance service. But it's like nothing. You report and you don't see anything. So I just forget about the whole thing. In fact, when we reach there, they try to find out how did we get to the hospital. So in fact, I put this same statement to them. I told them that this is what happened. But finally, we took a taxi. So after 37, their treatment, their services, everything is excellent.
Day in, day out, I keep hearing people talk about how they were treated sharply. When you go there, and especially you don't have money, and you are not known, you don't know anybody, you are almost left to your fate, and you have to find your way around and all that. So I think that we can do better than what we are doing today. And some of the nurses and health professionals, it's like when you talk about these inefficiencies, then they become offended. They feel you are attacking their profession or something. But I think we are all looking for the best for all of us. So I think they should all take into consideration some of these feedbacks so that we can all build a better country for ourselves.
A guy was wounded and they took him to Mission Clinic. From Mission Clinic, they referred them to Ridge Hospital. Getting to Ridge, they said they should go to Kolebu. But from Ridge to Kolebu, they have to enter ambulance. And they asked them to pay petrol to Kolebu. They gave the money, but they reached the Kolebu and they didn't buy any petrol. So we don't know where the money... The guy was treated and he came home.
I witnessed I was at a polyclinic at an area which I don't want to mention the area's name. I was there around 8 a.m. and when I got there, I saw someone there, a patient, who they said was there around 6 to 7 a.m. So when Cuba, the injury that the person was having was on the head. So I was thinking she would be attended very early, but she was asked to join a queue, even though she was seriously shaking and everything. So I think around 10 to 11 there, she collapsed and I don't know if she died or because she wasn't breathing and she wasn't moving. So I think with the emergency system at the polyclinic is very bad. When you are really sick and you get there, if you don't take care, you die. That is the experience I had.
Take money for a fuel, yet you don't buy the fuel. So in this case, meaning that's how they treat people, which is not right. Ambulance, you don't have any right to demand fuel money from patient who is dying. You understand? So those are the things that we need to address.
Terrifying. Hey, so listen, this is a message sent to me by a doctor who is a specialist in emergency care. Okay. He says, while my uncle was having a cardiac arrest some time back, a nurse was busy WhatsApping in a hospital right here in the heart of Accra when the patient was right in front of her. It had to take me to shout at her to get her out of her queenly seat. What do you do if you are sick? You go to the hospital. At the OPD, another sick person falls unconscious and a nurse starts screaming to the sick people, "Obimbro," and standing to look at the unconscious patient. So this person is obviously an expert in emergency medicine. He says that one of the biggest problems is that hospital staff are not adequately trained to handle emergencies. This is just one of the many issues.
Look, Kojo, and you're right. This is just one of the many issues. There are many people who have gone to hospitals, in taxis, when they should be in ambulances. But let's say they even got to the hospital. They get to the hospital and they meet the health professionals. And the first thing, probably you just get into a bed. And that's where they leave you. Sometimes they will tell you, you've been brought to the hospital with an emergency. You know what they tell you? Well, the specialist will be here on Monday. You're there on Saturday.
And it's an emergency.
Yeah. The specialist will be here on Monday. So wait. For now, we'll try and stabilize you, and then we'll wait for the specialist. They're not going to call the specialist to actually come in and see what's wrong with you. And there's been instances where people who have gone with high blood pressure, by the time the specialist showed up, they're in coma and never survived. Because somebody just thinks that, okay, well, it's all right just keeping you, wait for the specialist. If you identify the need for a specialist, why don't you get the specialist in to actually examine the person?
Winston, this matter is actually quite personal to me, and I have to moderate myself not to speak about it with emotion. But I've mentioned many times that one of the biggest reasons why it took me so long to come back home was because I was afraid. Once I was diagnosed with diabetes in 2009, I was afraid that if I moved back to Ghana, I would die. And it's because of what I saw when I fell sick. It was quite dramatic the way I was, taken ill and diagnosed. I had actually gone in for a regular medical appointment with my GP because I was feeling a bit weird. My blood sugar was very high at the time. I didn't realize. So I went in, they took a sample to go and do a blood test. Now, by the time I drove in, I was in a taxi with my partner at the time. By the time I moved from the GP surgery to my house, the result had come. And the GP had seen that my blood sugar was high. At this point, I had become non-responsive. I couldn't make any sense. My partner was asking me questions. Are you hungry? Yes. What will you eat? Yes. Like I was out of it. Then my phone rang. My partner picked up the phone, and the doctor's first question was, "Is he still alive?" She said, "Well, yes, but he's acting very strange." So I've called an ambulance. So my partner had called an ambulance by then. The doctor said, "I've called one too."
Okay.
They both arrived at the same time, literally within 2 minutes of that phone call. Both of them. And you see, it's even good that 2 ambulances arrived, because the first one tried to check my blood sugar, and their machine reads a blood sugar. It can give you a blood sugar reading all the way up to 49. If it's higher than 49, it will just say high. It won't give you the actual figure because it can only read up to 49 millimoles. So the second ambulance had other equipment that they were able to hook me onto, and that gave them an accurate reading of my blood sugar, which was over 118.
Wow.
So that is how they knew exactly what to do, what kind of sliding scale to put me on. This is what kept me alive, because I was in a coma for several weeks after that. But they were able to keep me alive because the emergency services arrived literally within minutes. Otherwise, Winston, we will not be having this conversation. I will not be here. If that had happened to me in Ghana,
You'll be gone.
yeah. So this is a very personal conversation for me, because it could happen to my son, it could happen to my mother, my sister, to you guys, to anybody I care about. And I would be utterly helpless. You know what? It's not about us. It's about you. This is your show. What matters to you matters to us. So call us. Call us. We want to know. I mean, first of all, have you ever had such an experience? What are your fears and concerns? If you have any, have you made a plan for yourself? And I'll tell you later on this show what plan I have made for myself in case of emergencies. Have you made a plan for yourself to survive an emergency? Something that will help you aside from what is provided by the state, because it is quite clear that that is not reliable. Call us. Let's talk about it. Have you had an experience with the emergency services? Are you worried about what would happen to you if you were the subject, or any of your loved ones were the subject of a medical emergency? What's your plan? Let's talk about it. 0302 216 541 055 111 Okay, 0302 216 541 and 055 111 997. All right. We'll be reading a few of your messages as well. But first, let's talk to Kwame in Takrad.
Okay.
Hello, Kwame. Good morning.
Yeah, hello.
Yeah, thanks for calling us, Kwame.
Okay.
Yeah, go ahead. We're listening.
One time that I see Ghana, we are in a crisis. I see that the healthcare we assess here, the port.
Kwame, can you perhaps hold the microphone a little bit farther away from your mouth and reposition yourself a bit so we can get a clearer signal? There's some interference in the connection.
Is it okay now?
It sounds much better. Yes, please go ahead.
So one thing that in Ghana I see, and this is because our politicians live a different life from ours. I think it would be very much better if all our politicians or all our MPs from president, everyone access the same healthcare the citizens access here, the same education our children and we, the citizens, pass through here. It should be illegal for them to access healthcare outside our vicinity. If you want to rule out, you should be able to enjoy the same benefits each and every individual is enjoying here. With that, everything will be better because this we all suffer together, so they will help to build it. Other than that, we all go through the same way. I lost a brother through these same services.
What happened?
So I'm very, very, very passionate about this.
What happened to your brother, Kwame?
With the same ambulance, the same he was left on the, there was no bed at police hospital.
Wow. I'm sorry to hear that, Kwame. And thank you for sharing. Yeah, you can call us too. You can share your experiences. We want to know, have you ever had to encounter the emergency services in Ghana? What happened? Tell us your experience. Was it with the ambulance or was it at a hospital? Tell us. Eric is in Amasaman. Hello, Eric.
Yeah, good morning.
Good morning, my brother. What was your experience?
My experience is with the hospital.
Mm.
My mother went off and we took her to Kolebu. She was revived at La Paz community, and they told us to go to Kolebu hospital.
Mm.
We went there, and I drove her to the hospital myself, and I went with the emergency to tell them, this is the problem. And can you imagine, the nurses were on their phones. They were on their phones. I had to go in again and then tell them, this is what's happening. And when they came, they told us, there's no bed. So they will suggest we go to GMC, that's the Legon Hospital.
Yeah.
And I would like to take this opportunity. I'm not advertising for any hospital, but UGMC, they are the best currently in this country. Even, let me see, in Accra.
Mm.
And can you imagine that these politicians who are in their constituencies, there's no even cheap compounds there. And you will see them with their family being taken care of at the UGMC. They leave their constituency and come to Accra, to the UGMC, for them to be taken care of. I think something must be done about this thing.
Yeah. Thank you, Eric. Thank you. Lawrence is calling us from Ridge. Hi, Lawrence.
Hello.
Lawrence, you're going to have to move away from the radio for us.
Yes, I've even off it. Good morning, sir.
Good morning to you. So, what was your experience?
Okay, so let me first say I'm very happy you are discussing about emergency services in Ghana. Let me first say I happen to be an ambulance driver.
Mm-hmm.
And I want to sort of tell our part of the story too. Sometimes when they call for emergency services, some road users behave on the road.
Yeah.
Sometimes you pick an emergency case, going to a health facility, and you'll be sounding your siren, and the drivers will not be giving you access. It's really, really disturbing, you know. So I also want to suggest, if it is possible, maybe you will educate the drivers that when maybe there is a hectic traffic, they should at least drive by a little closer to the shoulders of the road, so that the middle lane will be left for the emergency service, the police, the ambulance service, and other departments, the emergency services delivery agencies to use. So that is my suggestion.
Yeah, Lawrence, thank you for that. That's a very important suggestion to make. But before you go, listen, educate us a little bit. This thing with fuel, where every time, someone calls for an ambulance, almost every time someone calls for an ambulance, they are told to provide fuel. What's that about?
Let me say that it depends the department you are working at. For my hospital, I work for a private hospital, and we make sure that we are always running on a full tank. So it's not then that the emergency comes that we will come and ask you for fuel. There is a charge after we safely deliver the sick person or whatever to the health facility. The family comes and we settle our difference. So, but talking about maybe the National Ambulance Service and some of the departments, let me say this. I've been meeting some of them, and seriously, sometimes the fuel system is a big problem for them. And one of the most difficult things is maybe calling an ambulance and they don't have fuel. What about if they shot in the middle of the road and that place there wouldn't be any car to come and rescue, or there wouldn't be another ambulance to come and rescue the patient? So it is also a call on the government to make sure that even if they will have to fuel these national ambulance services from the constituencies, because I realize they are being stationed at the various constituencies. So if they can use some of the Disable Common Fund to be fueling it, it will help. Because sincerely, sometimes when you call, they will tell you, okay, they have given them fuel by the week, but somebody will call for emergency, and maybe because of the errands, coming, they can spend that fuel within 2 days. But maybe they are looking at it like this fuel can sustain them for maybe a week.
Right. So,
yes.
So you talk about errands. They use the ambulances for errands.
Not errands in terms of maybe going to buy something. No, I'm talking about picking sick people.
Right.
Maybe an emergency service, yes.
Okay, all right.
Because sometimes you get to the health facility, they don't have maybe a bed.
Right.
The person will have to be in the ambulance. The fire has to be on. Sometimes they will tell you, okay, go to this next facility.
Yeah.
It's all part of the errand.
Right. I get you now, Lawrence. Thank you. Thanks for that insight. I appreciate it. Let's talk to Nene in Dansoman. Hi, Nene. Good morning.
Good morning. How are you?
Very well. Thanks, my brother.
As we speak, there were some ambulances that were brought to this country that people are being tried. People have been put to court for.
Yeah.
And as we speak, those ambulances that were brought in and the parts that were supposed to be fixed into those ambulances for the use of the citizens are rotting, or is being left to rot at wherever they have been parked. And our priority is not to get those ambulances, fix them for the usage of citizenry, but our priority is how can we get those who brought it into jail. Meanwhile, as we speak, there are regional hospitals that do not even have one functioning ambulance. As we speak, those ambulances that were brought in with our money have been left to rot. The parts that were supposed to be fixed into those ambulances were brought in to be fixed. They are at the port rotting out. Our priority is to how we put those who brought those ambulances into this country into jail. Our priority is not how we bring those ambulances to the usage of the citizenry. I keep saying, the problem of this is with the citizens. Until we and hold people with position accountable will always be.
Oh, I think we're losing you. The signal is poor, Nene. Sorry about that. But I think we got the general thrust of what Nene was saying. Thank you for sharing, okay? We're going to North Legon now. Here's Ben. Hi, Ben. Good morning.
It's Ken. Could you?
Oh, Ken.
Yes,
thank you for the correction, Ken. Thanks for calling us. So, talk to us. We're listening.
Could you? I'll start by saying our authorities are wicked. They don't care. My reason for saying this situation that you're talking about, a couple of years ago, a partner of mine who's an expat was in the country. He got sick within the course of the day, and then he requested for an ambulance. It never came.
Wow.
So this got us thinking, and then we got in contact with a supplier or a software engineer in South Africa. We developed a software that can handle emergency services effectively. From a click of a button from your mobile phone, you can get an ambulance to come to where you are, and it's live tracking. We sent a proposal to the National Ambulance Service, and to date, there has been no response. We've gone ahead to try and partner with other local emergency service providers, and it has become a difficult headache. One of them has actually made a very good start. I don't want to mention the name, but they've done very good strides. But the header is that when they try securing funding, because of this same LGBTQ, they are not getting funding. So this whole project has stalled for over 4 years. Meanwhile, somebody is receiving salary to make sure that this service is effective. He goes to bed every day and wakes up. People are dying every day, and he doesn't care. He doesn't see the need of it, and that really hurts me. I don't know how we can work this, but we need people who have the heart to make things good. It's high time we do that.
Thank you, Ben. Thank you very much for sharing. All right. Bishop is in Asante Mampo. Hi, Bishop.
Good morning.
Good morning to you.
Anytime I want to talk about some of these emergency issues, I try to control my emotions. At times, we should also talk to our health professionals. Their attitude, their professionality. They should know that they are dealing with human lives, and any little time they waste can cause the death of the fellow or lead to some form of disability or incapacitation. I am a victim. I'm telling you this in 95 when I had an accident. The windscreen shattered and pierced through my eyes.
Wow.
I was taken to Kolebu Hospital. Teaching hospital. And the doctor in charge, the eye doctor in charge at that time, for on duty that day. Fortunately, could you let me tell you this? It's chilling. When I was sent to the emergency ward, a junior of mine was on duty. They were the people who went to Cuba and came, the first batch of medical. He was then on duty at the emergency ward. And one of them, another junior of mine, went to Cuba. He was a pharmacist. He was also on duty. Another mate of mine was doing his house. He finished Legon, medical school, was doing his house nursing. So they all mobilized and saw them, and then they organized that this is an emergency case. I was quickly prepared for theater. Only for this doctor to come and tell me in the face that my brother, I'll see you in 2 weeks' time.
Hey.
Come on. I got devastated. Kojo, I got devastated. I will see you in 2 weeks' time.
They told you this in the theater?
No, at the ward when I was sent. I was
right.
being prepared.
Okay.
I was being prepared to send to the theater. They actually informed her. She came that I'll see in 2 weeks' time. Because they told me that the glasses, the foreign materials in my eyes, they need to remove them within 48 hours so that they can save
your sight.
My sight. And when it happened, she said 2 weeks' time. I said, my God, what happened? I started shedding tears. I was crying. I couldn't see. My eyes were plastered. So I was there for 16 days, only for me to be discharged by people. One, Dr. Edu, who was then the president of the Surgeons Association of West Africa, Dr. Edu Dako. He was in Kwame Teaching Hospital. They came and saw. He said they should discharge me and bring me to him. When they took me to Kwame, the very day they took me there, he took me to the theater. He removed some glasses from my eyes. He told my people that, well, this is 50-50. I could see or I couldn't see. And when he removed the glasses, he gave it to them. They put it in my hands. I couldn't see, but I felt the type of glasses. And he said somebody was working at Guinness, and then a bottle exploded and pierced through the eyes. They brought it to the because they did the surgery within 48 hours. The fellow could see. And only for later on, let me tell you, that's the attitude, the professionals I wanted to come. Dr. Edu said he was going to investigate. He later on told us that, well, these things, they cannot talk much about them. But that doctor in charge that day had some issues with her colleagues. And therefore, anytime she has a case, nobody wants to venture to touch that case. Kojo, I'm telling you this. And the fellow, when they checked, she was traveling outside the country. And that's why she told me 2 weeks' time she will see me.
Hey.
So I should wait 2 weeks to come. Kojo, if I tell you the things that went on later, these are the things we are talking about.
And Bishop, you've been talking to us, for many years now. What's the situation with your sight?
I'm totally blind. I can't see. But 95, let me tell you another story. There was 95, when I was admitted at Kolebu, the 16 days that I spent there, that made me to fall in love with Joy FM. I had a small radio by my side. It was always on Love FM. Joy FM. And that's where I got, and that was, the Joy FM was, how would I say it? The radio station was established not quite some 3 months or 4 months when I had the accident.
Yeah.
I read about the radio station, those times PMP, the newspaper, Tommy Alan Foster and co, all that they prepared. So I just got in love with Joy FM since that time.
Wow.
And my dial is always on multimedia.
Bishop, that's why you are a part of our family and
yes,
always will be.
So when I call, I know what I'm about.
You definitely do.
Yes,
Bishop. Thank you for sharing.
Determination has taken me to a lot of places.
Yeah. Thank you for sharing your story. It's such an eye opener. Forgive the pun, but it's such an eye opener to think of how just the attitude of the healthcare professionals has resulted in your permanent loss of sight. Wow. Thank you, Bishop. Mame Ya is on the line here in Accra. Hi, Mame Ya. Good morning.
Hi, good morning.
I've
lost my voice, so please pardon me.
That's okay. Can you turn off the radio?
It's off.
Perfect. All right, we're listening.
So my issue is with UGMC. I just think that the problem is the people, not the facility. Because my son was almost out of breath. And I was told to go to Kolebu, but then it's far. I live at Agboba. So from Agboba to Kolebu, I thought, let me just rush him to UGMC. When we got there, he was rushed. When they checked his breath, they said emergency, so they took us upstairs. And he was on the bed for like 5 hours. A doctor will come, okay, I'm coming. A doctor will come, I'm coming. And all that he needed was oxygen. I had to be calling friends, my friends that are doctors outside of UTMC, for them to call. And then the doctors that he knew, like, had to come and say, like, come and shout and all that. So he was on the bed for like 4 hours before they gave him. And the oxygen was not like outside. It was just by the bed. They just had to pull the oxygen and put it on him.
Oh.
So I think it's the people. It's not the facility. You don't know what the love your neighbor has discovered. Because if you know and you know somebody's going to die, you won't come and stand there at him and go and come back later and just be loitering around like that. So I think it's the people.
Thank you. Thank you for that, Mamia. Hey, if that was my child, I would be losing my mind. Okay, let's go to Japan. Winston, your stomping grounds. Abu is on the line. Hi, Abu. Good morning.
Hello, good morning.
Yes, sir.
Yes, like somebody said, sometimes when you go to the hospital, they should understand that that is the last place you want to come. So the moment you come there for a reason. I don't understand when you go to the hospital and this child is shivering and you have to sit down for a long time before now they will attend to you. And like somebody talk about the professionalism as well. I think some of them don't really understand, because when I took my wife, I'm not a medical doctor. I'm not a professional. I only suspected that she's pregnant because of the way she vomit and all that. So I brought her for you, the professional, to confirm my suspicion. Then you are now forcing me to confirm she's pregnant. What thermometer do I have to check that she's pregnant? I suspected. That's why I bring her to you, the professional, to confirm my suspicion. And now you are telling me to confirm whether she's pregnant or not. Until a senior colleague came. And sometimes when you want to get annoyed, go to the hospital. There are people who also sit at the OPD there. Then you think I'm nuisance. I'm causing trouble. Meanwhile, support me and tell the person that you are the professional. So confirm his suspicion. What thermometer do you give me to check on her? And you think this is what people do. Even if you are in a throttle and the driver is driving somehow, and you want to tell the driver, "Our driver, be careful." Then instead of them to help you to talk to the driver, they think you are a nuisance. What is wrong with our orientation? Sometimes when you talk about the ambulance, I was watching, Cheaters, this program on DSTV. 2 women are fighting on their husband. When he got violence and they called ambulance, like you said, 2 ambulance came right there and then. 2 ambulance. Sometimes we don't take human life serious in this country. Thank you.
Thank you, Abu. Thanks for that. Wow, goodness. And you can imagine his frustration. Salifu is in Koforidia. Hi, Salifu. Good morning.
Hi, Kojo. Good morning to you. How are you and your team?
Yes, thanks for calling.
Kojo, at times when I hear of you people, then I become sad. What is happening into this our country for so many years? Kojo, the attitude of our health workers. Don't they know that it's a calling? If you are working in the hospital, saving lives, it's a calling. So they should change their attitude. The way they recruit our nurses, because there is no work, everybody can just wake up and say, "I want to be a nurse." Kojo, they should be serious about the recruitment. Kojo, because of all these things, let's punish NDC and NPP. And let's get an independent person to come, so that for the 4 years, we'll see whether things will change or not. Thank you.
Thank you, Salifu. All right, I think we have time for one more caller. This is our 10th caller this morning. Stephen is in Aveno. Hi, Stephen. Good morning.
Yeah, good morning, Kojo.
My brother.
Mine is something else, not necessarily with the medical facility itself, but also within the hospital. Yesterday, I went to visit a friend at Kolebu, the medical ward.
Right.
Now, I was shocked at something that happened before. In the morning, the visiting time is between 7 and 7:30. Now, those people there, they I don't know who they are. They appear to be security or whatever it is that would open up for you to get in. They have nose marks there that they are selling. Now, this nose mark, I even have in my house. The whole box is 4 CDs. And they will sell to everybody mandatory 1 CD per nose mask. For 50. They are selling one for 1 CD, one nose mask. And the whole box is 4 CDs. Now, and without a nose mask, you will not be allowed to. And they themselves are not even wearing one. And somebody you see within is also not wearing any nose mask. I get in there, the nurses, the people. So you just have to have the nose mask at the entrance, and once you get in, you remove it, and that's it. And it is crazy. And they are demanding everybody coming in buy a nose mask for 1 CD. Now, and the authorities are just looking on. I don't know whether they are also cashing in on that. I don't know. But this is fleecing the public. I just can't think far. So I thought I had to bring this one up. And it's not just at the medical ward. It is at every point in Kolebu where you need to go and visit somebody.
Thank you for drawing our attention to that. That is actually shocking, scandalous. We will certainly want to follow up and find out the detail of that, and understand what the policy is and why it is so. I mean, for me, it's not so much about the cost of it, which is interesting, but it's about the fact that the people who are selling it to you are not wearing masks themselves, but insisting that you are not allowed into the space unless you pay for a mask. That's the aspect of it that surprises me. But look, we need to talk about this. We'll be hearing from Dr. Foster Ansong Bridjan, who is Acting Director of Operations for the National Ambulance Service, and Kwame Sarpong Asiedu, pharmacist and fellow at CDD Ghana. He's joining us via Zoom. I think he's actually on right now. Kwame, good morning to you.
Good morning, Bridjan. Wednesday.
Yeah. Listen, before we take a break, let me ask this. How much of the problem with our emergency services is a human issue, and how much of it is a money issue?
I would say 50-50. Because, and I would explain it this way, money issues emanate from human will. Because we give people leadership to take decisions and prioritize. They have to make the decision where the money is spent and what is priority.
Right.
So if you get a square peg in the round hole, then the human issue compounds into a money issue. Though I acknowledge that at this current point where we have challenges with our finances, our fiscal space is constrained, but it's still a money issue. Even within the fiscal space constraint, there is an envelope for health. So how are we using this envelope? And that's why I'd say it's 50-50.
Okay, well, listen, before we take a break, good morning to Dr. Foster Ansong Bridjan. Thank you for joining us, sir.
Good morning.
Doc, we have a lot to talk about. There's a lot for you to educate us on. But before we take a break, maybe you can give us just one number to think of. How many ambulances in the Ghana are available through the Ghana Ambulance Service in Ghana today?
We have 300 ambulances.
300 ambulances for 30 million people. Okay. We'll talk more when we come back.
Yeah, but Doc, these ambulances, how many of them are functional?
About 85% of them are functional at any point in time.
85%?
Yes, please.
So if I were to put a number to that, I just want to be, I want to be able to quote you the next time I make have any conversation about it. So we're saying that of these ambulances, 255 of them are functional at any point in time.
Hopefully so.
Doc, when you say hopefully, what are you suggesting?
So I'm saying that because it is at any point in time, some will go to the workshop for servicing and other things. That's just availability-wise. We are expecting that at any point in time, 85% of the ambulances across the country are functional and ready to move for any case.
Okay, all right. That's something to think about. There's more from Dr. Foster Ansong Bridjan and Kwame Sarpong Asiedu after these messages.
Your morning radio.
Dr. Ansong Bridjan, before the break, you explained to us that currently, for a population of 30 million people, we have, hopefully, in your words, about 255 ambulances. I remember there was a lot of fanfare and ceremony around the purchase of some 300 ambulances a few years ago. How many ambulances have we added since the purchase of those 300?
Okay, thank you very much for giving me the opportunity this morning. And before I go on, let's put the discussion in the right perspective so that our listeners will appreciate where the National Ambulance Service started from and where we are at the moment. We all do know that not until 2004, there was no emergency medical service in terms of pre-hospital care in our country. And so after the unfortunate 2001 Accra Sports Stadium disaster, the National Ambulance Service was established in 2004 as a result of one of the recommendations from the Commission of Inquiry that investigated that unfortunate incident. The service started with just 7 ambulance stations as a pilot in 3 regions, 3 in Greater Accra, 3 in Ashanti region, 1 in the Eastern region. As we speak now, we have grown from that 7 pilot stations with just 64 emergency medical technicians to a total of 297 ambulance stations in every constituency of this country. And for that matter, every district has an ambulance station. And in addition, there are few at a very strategic location, making the total of 297 ambulance stations, which we are running with the 300 ambulances that I mentioned earlier. And so that is how far we've come as far as the service is concerned. And I can also say that within this period, if you even take from 2020 down to 2024, when we received these new ambulances, we've been able to respond to cases, averagely about 35,000 cases every year. And so the service has been doing this, and most of these cases are medical and trauma. When you say trauma, you are talking about road traffic crashes that we respond to at any point in time. And so, coming back to your question, and with this background, we received this new the new ambulances in 2020, the 300 ambulances in 2020. And we've been using these ambulances over the period. And as we speak now, we just received additional 26 ambulances, which are of the Toyota Hilux type, which we are now registering them, and very soon we will distribute them to various locations. These ones are going to be used for rapid response as advanced life support ambulances, so that in case of any emergency in our emergency, these ambulances will take the lead and go after a rapid response, stabilize the patients before the other ambulances, if they need be, will also join when it comes to large and mass casualty incidents. So this is what so far we have been able to do.
Can you explain that one more time? So you are buying, you've bought 26 new ambulances, which you are registering, and they are going to be used for rapid response. I thought ambulances are for rapid response anyway.
What I mean is that we are going to set them up in every region as advanced emergency medical response teams who are going to do this. Because there are cases that some of our EMCs are unable to manage because of its sophisticated nature, and so these ones are going to be tailored for where the advanced medical technologies whom we have trained are going to man, where they can do intubation and higher level of airway management will be done in those ambulances. That's what I mean.
Right. Okay. Kwame, I mean, you've seen emergency services in operation in various parts of the world. What are your thoughts on ours? Of course, it's not only about ambulances, but maybe we'll start with ambulances. What are your thoughts on how Ghana is approaching the situation?
Kojo, thanks. I think I would say if you permit me, I'll park the ambulances for now because I have been listening all through since morning. I've been listening to the concerns that people are raising. And we seem to be focusing on towards the end and have neglected the beginning of the whole problem. And what do I mean by that? Emergencies are a process. When an emergency happens, you are firefighting. So let's say you collapsed or you had a car crash or something of that sort. Do the people around you even know what to do? Because that's a lifesaver. That is a huge lifesaver. If the people around you know exactly what to do when you go into an emergency. And I ask myself, does the average Ghanaian know what to do to identify what an emergency is? Let's say someone is getting a stroke. Are we educating the citizens appropriately to identify the telltale signs and know what to do? At what point to call an ambulance? Do people know how to give CPR? What is the availability of civilian emergency equipment in our community? If I talk about civilian emergency equipment, availability of defibrillators that have DIY information on them that the person can use in an emergency. Does the person know how to communicate with the ambulance team? Give them relevant information as to exactly what is happening to you who is in an emergency. As Winston puts the question, assuming you are non-communicator, does the person know how to communicate with the emergency team? Does the emergency team then know how to communicate with the person as to how they need to give them relevant information and how they need to maintain you until the emergency team can get there? That's the next thing. Then how quickly will the emergency team get to you? What is our ambulance response rate? How quickly can they get to you? Because in an emergency, time is of essence. Like if you come to the UK, they'll tell you the average ambulance response rate should be 4 minutes. Between the time of the call, it should be 4 minutes. And I was listening to my colleague panelist, and he said something that is very instructive, and I'd want to commend them for that. What he talked about, rapid response. Even in the UK, Kojo, they are rapid response ambulance teams. They use saloon cars. And they have to respond within 1 minute, 30 seconds. Because when it happens and the main ambulance is coming, sometimes they are located, they are running local to the community. So once the call comes, they can tell them, and they are more highly skilled. So they can rush quickly to the scene while the main ambulance comes, or if it's, say, a car crash, while an air ambulance is called. So that is the next level. How quickly would that ambulance get to you? Then when the ambulance gets to you, how quickly would you be stabilized? And while they are transporting you to the health facility, what is the communication between that ambulance and the health facility? And when you get to the health facility, how quickly can you be transferred? Then more importantly, who can give information about any medical conditions you, the patient, has to either the ambulance team or the health facility? These are key. They are extremely key to your survival. So now that I've addressed that, because I was listening and everyone could hear people say, oh, I went in a car. I heard someone talk about, the nurses, he wanting them to check whether the patient was pregnant. Most often, that is a standard question in an emergency they would ask. Could the patient be pregnant? It is not that the ambulance team do not know, but if they do know, they need to act in a particular way because they are then saving 2 people and not 1. So they ask to elicit the information assuming you know. That doesn't necessarily mean they are incapable of finding the information themselves. So then, now let's get to the ambulances. My colleague says we have, let's say, about 300 ambulances working, assuming we add the 20 rapid response that he's talking of, for 33 million people. Kojo, that means 1 ambulance to over 30,000 people, if my mathematics is right.
To 300.
I'm sorry, to over 10,000 people, if my mathematics is right. That is a huge, tall order. So though, picture the scenarios, though there might be an ambulance station in almost every district, and hopefully with a functioning ambulance, should there be a situation where two emergencies, and these things can happen easily. Somebody can have an accident, somebody can then have a heart attack, and someone can have an asthma attack in 10,000 people. Because you are
Kwame,
talking
it's
about...
It's actually 100,000. Okay, one ambulance.
Yes, that was 100,000. Yes. So in 100,000 people, you are talking about 3 emergencies happening in one go, which is about what percentage? Less than 1%. And you have one ambulance in that district. It means 2 are going to go without. It also means in that district, should there be a car crash and it is a public transport, they would have to scramble for ambulances from other closer districts. Or go in private cars and stuff like that. Would the people transporting these people to the health facility know how to even handle them while they transport them to the health facility without worsening the emergency they find themselves? So why am I looking at the background and surrounding? What I'm trying to say is, it seems to me as a society, we haven't scratched the surface of emergency management. To the best of our ability. I take on board the fact that the ambulance service started after the May 9 disaster and all that. That's fine. But we are talking of almost 2 decades ago. So if we haven't made significant strides in educating the public around all these things, and you see, we shouldn't leave it at the doorstep of the National Ambulance Service, because Kojo, it's you and it's I. And when you guys asked that I come in as a panelist, I was looking at the Nice Health Assessment Report for Ghana. And Kojo, you have a copy. And if you see that they tell you that even amongst our hospitals, how many of our emergency practitioners have had standard training in the last 2 years? You can look at the report and tell readers. How many have had? It is the second line. I can read it, but I want you to read it today.
I'm going to read it. I'm pulling it up, but keep going.
Yeah, I'm saying that look at it from that point of view. How many have had training in the last 2 years? And you know that in an emergency, because healthcare is also a vocation, skill is very, very important. So if people haven't had training in the last 2 years, and the state knows, because the document is an official state document, the state knows that many people haven't had training in the last 2 years.
This is what the report says. Most facilities offering palliative care or emergency services do not have staff who have received training in the past 2 years preceding the survey and have no guidelines for those services. It says here most.
Yes, most. So it means over 90%. Kojo, so if you were being driven to an emergency facility where most haven't had training, or more importantly, they don't have guidelines. They have no guidelines, zero. You see, and that was why when you asked me the first question, that is it a money problem or a people problem, I said 50-50. Because when you read reports like this, like I read on a daily basis because of the sort of work I do, and you see things like this, you realize that the problem is way bigger than the number of ambulances we have.
Yeah.
It is way bigger than whether we have money, and transcends into prioritization and leadership.
So,
and that for me is where our emergency system is failing. So to answer Winston's question straight, Should I collapse in an emergency and I go nil, I cannot speak, how confident am I of surviving if I were to be in Ghana? I'll say less than 5%. Based on the report, based on all these things I've said.
Whoa. That's a death sentence. That's a death sentence right there.
Read the snapshot of the health harmonization report. If you go further down, when you read a report that tells you that only 5% of our consultation rooms have the full complement of diagnostic equipment to make an accurate diagnosis, aka 95% do not. You see, Kojo, and that is why I am saying that we need to avail our minds to the fact that this is a prioritization issue. And that is why some of us were saying in 2020, when we were doing the pomp and pageantry and dancing about ambulances, was that the ambulances were a good thing, but they were not going to solve the emergency care situation. And people didn't get it. But I now get people to go and read the health harmonization report. And you see, Coach, this is what concerns me. This report has been out since July of last year. Has it even been discussed by the press? Have they taken the report and gone to apologize? Forget about the likes of my co-panelists who are implementers. They are technocrats. They do not buy the ambulance. Have we taken this to the doorstep of the politicians, people on the Health Select Committee, the Minister of Health, Cabinet, to say, this is your terminal report from the WHO, the Global Fund, the Ghana Health Service. This is the terminal report of the emergency system you are running. What are you going to do differently? Have the journalists done that? Do Ghanaians even know reports like this exist? Do they know how dire the situation is when they read reports like? And for me, Kojo, that is the bigger question.
Yeah. Okay, Dr. Ansong, Ansong Bridjan, a couple of things. First of all, could you help us with the average ambulance response time for Ghana?
Thank you very much. Currently, our average response time is 22 minutes.
22 minutes.
We do know that, as we've already established, that we have one ambulance per a district. And if the ambulance moves for a case within the district, some places you will have to travel about 50 to 100 kilometers to reach your destination or where you are going to pick the patient. We also do know that the scarcity of the ambulances also makes it difficult to improve on our response time as we are looking for. But there are other factors, including the road network and also the congestion on our roads, all contributes to the response time. And so as we speak now, we are looking at 22 minutes. Some places, they can make it within 5 minutes, 10 minutes, depending on the location of the incident.
Right.
But other places that you have to travel longer time because of where the case is found.
Now, Doc, I'm sure you heard our callers and a few of the messages we read. This recurring problem of ambulance service asking for fewer money. What's the situation with that? Why are we still facing that problem?
Let me emphasize here that when it comes to emergencies, there's road traffic crash and ambulance is called. Nobody requests for any fuel to respond to such an emergency because we are always making sure that the ambulance has fuel to respond to such emergencies. If there's somebody at home, a pregnant woman in labor with complications and the ambulance is called, nobody asks for any money from such a person. So as far as our emergencies are concerned, we don't actually ask anybody to pay any money upfront before the ambulance moves, because we make sure that at least there is fuel in the ambulance to respond to such cases. The only time fuel is demanded is when you are to transport patients with over long distances from a health facility to another health facility. And we all do know that sometimes a patient is moved all the way from, let's say, Tamale to Konfanochi, a distance of over 400 or 500 kilometers. So if you are doing such a journey in and out, and whatever amount of fuel that is given to that ambulance, even if it is full tank, it may not be able to move such a case from that distance and back to base. And so we make provision that such cases which are from health facility to another health facility, the relatives or the patient relatives must support the ambulance service to be able to move for that long distances. But internally running cases, those ones are done free of charge. It is only when we have to move patients for that long distance. And as we even speak now, government is making provision through the National Petroleum Authority to find means of providing us with additional fuel through the National Security Services fuel system, whereby government will provide additional fuel to enable us to move cases. But as I said, there are long distance cases that we cannot do anything about it, that patients or patient relatives must support us to be able to transport patients along that kind of distances as it is now.
I want to read you a message someone sent me, okay? It says, some years ago, my younger sister was involved in an accident. She hit a drunk pedestrian. She drove the victim herself to the 37 military hospital. I was called from the office. I got there, and after 5 hours of examinations and x-rays, it emerged that he needed to be transferred from 37 to Kolebu or Ridge. I made contact with the doctor at Ridge and shared the x-ray shots with him. He said to bring the patient immediately. So we needed an ambulance to transport him. The ambulance was right there. First, they said they did not know the whereabouts of the driver, so he had just come. Sorry, I just lost it here. Whereabouts of the driver, as he had just come in with another case. Kojo, for 2 hours we were waiting. When he finally showed up, he said he needed clearance from their boss before he would move. By this time, the doctor at Ridge had called twice, saying it was critical for the patient to be brought in, and they couldn't dispatch an ambulance either. Long story short, the patient was sent to Ridge after 4 hours of waiting, right by the ambulance. Upon arrival at Ridge, he was sent straight to theatre. Doctors said the patient suffered a brain damage as a result of the delay. The 32-year-old man is now confined to a wheelchair, has lost his speech, and needs total care. My family has had to support him from that time till now, thanks to a failed system. What do you say to this, Dr. Ansong Bridjan?
Well, I think there are exceptions that sometimes there are some challenges here and there. And I cannot actually attribute it to the failure of the National Ambulance Service in responding to such a call. Because we also do know that sometimes if you, not that they want clearance, but the whole issue is that when sometimes you are referring a case and you don't get the receiving facility to confirm, you end up moving around so many hospitals because you get there and they say the facility is not ready, bed is not available, and those kind of things. So they always want to be sure that the facility has confirmed the readiness to receive the patient. And this particular one that you are talking about, it may be an exceptional issue because we don't have the facts to actually prove what the man is saying, whether it is truly what's happening.
But it is a report from... It is a report from your...
for over 2 hours without responding to a call.
Dr. Ansong Bridjan, it is a report from your customer, your client. They are saying that due to delays caused by your ambulance driver, they waited 4 hours standing next to the ambulance, just waiting to be transported. If it takes 4 hours to determine whether an order to move an ambulance is confirmed or not, then clearly there's a problem with your system, isn't there?
That's what I'm saying. This particular case, I cannot confirm as exactly what happened. Because if the ambulance was at the health facility, it would be strange to say that for 4 hours the driver could not be found. So we need to actually investigate to find exactly what's happened. Well, this is the person's word that he is saying. We weren't there, and it will be difficult for us to prove this. Because I cannot understand how an ambulance will be in a health facility to drop a patient there, and the driver of the ambulance cannot be found for over 4 hours. It is something that it cannot be possible.
Okay.
And since we don't have the facts from our end, it will be difficult for us to actually confirm or deny this particular case.
Okay. Now, Dr. Ansong Bridjan, you've talked about how 85% of the 300 ambulances are working. You've talked about how you've acquired an additional 26 or so. In your plan as the National Ambulance Service, how many ambulances do you believe a country like Ghana needs to be effective?
Thank you very much for this question. You do know that WHO standard, every 50,000 population needs one ambulance, at least, or at most 50,000. And so if we are talking about over 30 million population, then we are talking about not less than about 650 ambulances within the population that we have now. So we need not less than about 650 ambulances across the country.
And in the absence of which you cannot perform effectively.
Pardon? I didn't get the question.
In the absence of the at least 650, you cannot function effectively.
What it means is that for us to be able to reach the ultimate, where our response time can be improved within the acceptable international standard of between 5 and 10 minutes, then in that case, we need to ensure that there are more ambulances stationed at various locations. We have to move to the sub-district level and even to other towns within the district. So if you have enough ambulances, then we can say that we'll be able to improve on our response time. And so to be able to function as expected, then it means the number of ambulances will need to be improved so that we will be at the various locations, be able to respond on time. And what currently we have done to even improve what we have is that the major highways, we have been able to establish ambulance stations along the major road highways so that in case of any road traffic crashes, they can respond on time. So if you take from, we have in almost all the major towns along the line, right from here, Achimota, Amasaman, Nsawam, Asuboi, Suhum. Then you move on to Bunsu Junction, then to Enyinam, to Nkoko, Jaso, all the way to Kumasi. That is how we have located the ambulances, so that in case of medical concerns and also a public health concern, we will be able to respond appropriately and on major rules.
Let me just check this with you before I bring in Kwame Sarpong Asiedu. Currently, the response time is about 22 minutes, the average response time.
Yes, please.
And we know that for most emergencies, if it's a respiratory issue or, some heart issue, there aren't many emergencies that the patient can survive without medical care for 22 minutes. So, looking at this with your professional eye, is it fair to say that in spite of your hard work, the Ghana Ambulance Service is currently not fit for purpose?
You can say that. And as I started giving you the background, how National Ambulance Service have come so far, we were not having anything at all. But now there is something. So let's look at what we have and say that the cup is half full instead of half empty. Because if anything at all, the data I have indicates that we've been able to respond to over 38,000 cases last year. imagine there is no ambulance service. Majority of these people might have had their lives lost. But if you are able to save this number of lives through the movement and management of these cases and transport them safely to a health facility for them to continue care, then it means without national ambulance service, definitely most of these people might have lost their lives. Okay. So let's look at the positive aspect of what we've been doing instead of looking at it in the negative line. Because no matter what, even though there are challenges, we cannot say that we haven't done anything. We are improving. And we believe from 7 ambulance stations to 297 ambulance stations, the difference shows that indeed the nation is progressing steadily. And it will come to a time that we will be saturated, the whole country will be saturated with ambulance stations, and we will be in a position to meet the international standard that we are all aspiring to reach.
Okay. Thank you for that. Now, Kwame, I have to give you the last 30 seconds here. And this is what I want to know. Less than 55% of hospitals and polyclinics offering emergency services have any cardiac intervention services. Of the essential equipment for breathing intervention, are available in about 40% of facilities providing emergency services. Kwame, who should we sack for this situation? Do we still have Kwame?
Yes, you have me. Can you hear me?
Yes, we can hear you now.
Yeah, I said this is down to decision making at the political level. This is not done at the ambulance service level. Because who takes the decision to spend money on behalf of you and I in Ghana? It's people in the executive. And so this goes straight to the doorstep of the Ministry of Health, the Health Select Committee, and Cabinet. But the buck stops with the President. And that is why I asked, when I spoke earlier, that why has a report like this not been discussed thoroughly? And why are the journalists not bringing in the politicians and all those who presided over this to answer for such a bad, outcome? I'm not one who goes by this glass half full phenomenon. There are certain basic things that need to be done. Yes, maybe we might not have enough ambulances, but what about training the staff? Is that also rocket science? So that is, if you ask who has to be sacked, the answer is we need to hold the people who take the political decisions accountable for this. And this rests squarely at their doorstep.
Back to the politicians once again, Kwame. This conversation is at its beginning. Like you said, there is a lot to talk about. This report alone should generate so many days of conversation if we want to improve the healthcare and emergency delivery service in this country. If we don't want our children, loved ones to die because our emergency service is not up to scratch. Thank you very much. Kwame Sarpong Asiedu is a pharmacist and fellow at CDD Ghana. Dr. Foster Ansong Bridjan is acting director of operations for the National Ambulance Service. Thank you both for your time this morning.